Hi, my name is Jacqueline Meyer and I'm a family nurse practitioner student, and today I'm going to be discussing abdominal assessment techniques to help the practitioner assess one's risk for acute appendicitis. Nurse practitioners in any setting, whether it be emergency departments, acute hospital, inpatient units, urgent care, or family practice clinics, will undoubtedly experience patients that complain of abdominal pain. In fact, abdominal pain has been cited as the most common reason for going to the emergency room for patients in the age groups of 18 to 64 years old, and the third most common reason for going to the emergency department for patients over the age of 65. Practitioners' careful assessment and diligent history evaluation and review of systems can help narrow down the potential 100 diagnoses that are possible and narrow it down to what the most likely disease process is. In the United States, 250,000 cases of appendicitis are reported annually and account for nearly 1 million patient days of admission. In the hospital and emergency care department, testing such as CTs, ultrasounds, blood panels, and urinalysis testing are easily accessible and readily available to practitioners, but that is not always the case in urgent cares or rural family practice or even rural hospital settings. So for that reason, it is crucial that NPs are equipped with the necessary abdominal assessment techniques to help best diagnose a patient with appendicitis, or just even identify one's risk of appendicitis. Therefore, they can either care for them in the setting that they're in or refer them on to the next level of care. Today I'm going to be discussing 5 special abdominal assessment techniques to help the practitioner identify patients that are at risk for appendicitis. The first test that I'll be discussing is McBurney's point tenderness. McBurney's point is located in the right lower quadrant. Specifically, it is located medially from the superior iliac spine, anterior superior iliac spine, or otherwise known as the hip bone. It's located 2 inches medial to that in the area where the appendix is. Typically, point tenderness indicates that there is an underlying pathology in the area that is being assessed. So for our purposes in the right lower quadrant, that would be McBurney's point tenderness would indicate appendicitis potential. Deep palpation with the patient lying supine is how to best assess for McBurney's point tenderness. The next example of an assessment technique is rebound tenderness. The practitioner would apply deep downward pressure in the location of the right lower quadrant, and with the sudden release of their hands, if the patient experiences pain on release of the hands, that would indicate rebound tenderness. Similarly with rebound tenderness is Rovsing's sign. Rovsing's sign is looking for rebound tenderness in the right lower quadrant when downward deep pressure is applied to the left lower quadrant. So with deep palpation in the left lower quadrant, the patient would experience right lower quadrant pain on the release of the hands. The next sign I will discuss is psoas sign. This test, the practitioner is isolating the psoas muscle, which runs right near the appendix, and inflammation or irritation of that muscle could indicate appendicitis. So if the patient, with their legs slightly bent and flexed, I'll have them try to apply some upward pressure while I apply some downward pressure. And if the patient is experiencing right lower quadrant pain with this movement, it would be considered a positive psoas sign. The last sign I'll discuss is obturator sign. With the patient have their knee flexed and up at this point, I would internally rotate the knee, and if pain is felt in the right lower quadrant, that would indicate obturator muscle irritation, possibly caused by appendicitis or inflammation of the appendix. Because acute abdominal pain is so prevalent amongst all age groups and is seen so frequently in all areas of care, it's crucial that future practitioners as well as current practitioners are skilled with abdominal assessment techniques and are able to identify patients at risk for acute appendicitis. Thank you.